आई थिंक शायद हो गया है.
Can you take a picture of that green wala screen and share it
I think it is
where you
there.
enter the
So
screen key?
can you just confirm? Am I online?
Sorry?
Am I visible right now?
No, no. But take a picture of that screen. I
No,
mean that screen where you
I
put the
think
screen key. That
everything is
window.
fine now. I am online. Okay. So good evening, friends. This is Dr. Vineet Sehgal. Sorry for the 5 minute delay that was there, but now all the technical issues sorted out. So this session would be a video based question session. I would be just telling you the basic concepts of ophthalmology by few videos. Okay. So let's start our session with my first video. Can you all see me? Can you all see me right now? Okay, perfect. So the first video I am going to show you is a cataract video. Okay, perfect. So can you see this video right now? So what we are doing is, here we are putting a corneal incision. Okay, and through corneal incision we are going inside the eye. Can you appreciate here? We are going inside the eye, and then what we are doing is, we are putting the viscoelastic inside. Then what we would do is, we would do a capsular access. What is capsular access? Capsular access is basically the opening of the anterior capsule. Now after the viscoelastic has been put, now the next step you would see is the capsular access going on. So can you see here, I have made a cut in the anterior capsule, and with the 26 gauge needle I am making an opening in the anterior capsule. Okay, so these are the steps of the cataract surgery. After I have made an opening in the anterior capsule, what is the next thing I would do is, I would do the hydro procedures. What is the meaning of hydro procedures? I first basically separate the anterior capsule from the epinucleus and the cortex, and then with the help of the jet of the water I am basically separating the layers of the nucleus. So can you see here, now the nucleus is well delineated, and now I have done the phacoemulsification. Okay, so in my left hand I have a chopper. What a chopper does is, chopper basically cuts the nucleus, and with my phacoemulsification probe I am basically cutting the nucleus. What is this procedure called? This is called chop procedure. Okay, I am chopping the nucleus breakage is going on. Can you see, I have just broken down the nucleus. Okay, and after breaking the nucleus I am aspirating the nuclear material with the same probe. With the chopper I am feeding the pieces into my phacoemulsification probe. Can you see how beautifully the cataract has come inside the phacoemulsification probe? So this is the beauty of a phacoemulsification surgery, that without any suture, with just 2.5 to 2.8 millimeter incision, I can go inside the eye and remove the cataract from there. Okay, so after I have done the removal of the nucleus and the cortex, any remaining cortical or subcortical material I am aspirating it. Okay, so can you see, all the remaining material I am aspirating it right now. Beautifully done here. And after I have done with the aspiration, the next step is, what I would do is, I would put an intraocular lens inside. Okay, so can you see here, I am putting, this is the unifocal acrylic intraocular posterior chamber intraocular lens. I have put it beneath the anterior capsule and above the posterior capsule. This is called in the bag formation, or in the bag implantation of the nucleus, of the intraocular lens. Can you see? So I have put the intraocular lens inside. So this is basically a cataract surgery going on. Okay, so you understand, Prabhakar, what is the cataract surgery? So you won't ever, when you see these videos, you won't ever get confused about the steps of cataract surgery. You do the hydrodissection, you do the hydrodelineation, and then you remove the cortical material, and finally you put an intraocular lens. Is it clear, Dr. Prabhakar? Okay, so another surgery which can be asked is a trabeculectomy surgery. Can you tell me where we do a trabeculectomy surgery? So trabeculectomy surgery is done in a basically in a advanced glaucoma patient. So can you see here what I am doing is I have made a partial thickness scleral flap, and then I am basically removing a part of sclera. So if you can appreciate here what I am doing is I am basically making an opening in the sclera. Dr. Shafiq, I am making an opening in the sclera which acts as a pathway through which the aqueous can flow into the subconjunctival space. Okay, so can you see here I have done this, and after doing this what I do is I can then close the flap. Okay, so this is basically a trabeculectomy surgery. Trabeculectomy surgery is basically done in those cases of glaucoma where even after maximum medical therapy, okay, you have given your PG analogs, you have given your beta blockers, everything you have given, but still the IOP is not under control. The target IOP is not basically achieved. So in that cases, we do a glaucoma filtration surgery, which is called trabeculectomy. Is it clear, Dr. Shafiq? Give me a thumbs up. So I am showing it again. I made a partial thickness scleral flap, and after making a partial thickness scleral flap, what I am doing next is making a opening in the sclera. Okay, this is basically a trabeculectomy surgery going on. Okay, so another surgery they can ask you is a vitrectomy surgery. So where we do vitrectomy surgeries are done in the cases of tractional retinal detachment or chronic retinal detachment. What I do is I put instrument inside the eye and I remove whole of the vitreous, and then I do photocoagulation of any break there and remove the fibrous strands. Okay, so Shafiq, if you can appreciate here, I am removing the material. Let's say there is a nucleus drop. I have removed the vitreous, and then I am removing the cortical material from the retina. And can you appreciate here these spots? Can you appreciate, Dr. Prabhakar, these spots? So these are the laser spots we have made in this case. Okay, so see here a vitrectomy surgery going on. Where we do vitrectomy surgery, we do it in some types of retinal detachment. Okay, and also we can do it in the cases where, let's say, there is a nucleus drop or intraocular drop during a cataract surgery. Okay, so this is a vitrectomy surgery going on. Okay, so the next type of surgery or next type of procedure is a intravitreal injection. Can you anyone tell me where we do intravitreal injections, where we put intravitreal injections? Anyone? So if you can appreciate here, this is a intravitreal injection going on. So 4 millimeters from the limbus with a 26 gauge needle, I am going inside the vitreous cavity. Okay, Prabhakar, can you appreciate here? So a intravitreal injection is given when, let's say, there is an endophthalmitis. Also it is given when there is a cystoid macular edema. Also it is given whenever there is a posterior uveitis. You can give dexamethasone implant also. So Shivam, I am showing it again. See, 4 millimeter from the limbus, I have taken the mark, and then with a 26 gauge needle or a 30 gauge needle, I am going inside the vitreous cavity. Are you able to understand, Dr. Prabhakar? Okay, so this is a intravitreal injection going on in a case of, let's say, endophthalmitis. Okay, so the next video I would show you is, okay, so any doubts regarding the videos shown till now? Okay, so the next is a procedure which we do in OPD. So can you tell me in the comment section what is this procedure called? So I am staining the eye. First is I am staining the eye with fluorescein strip. Shivam, I am staining the eye with fluorescein strip, and now I am putting the patient's chin into my slit lamp. And after putting the patient's chin to my slit lamp, I am switching off the lights, making it a dark room. I have basically made now, can you appreciate here? I have put a cobalt blue filter. Can you see the blue light here, Dr. Prabhakar? So now I am touching the blue light with the cornea. Can you tell me what is this procedure going on? Can you see here what is this procedure going on? Please comment, put it your answer in the comment section. So this is basically a applanation tonometry going on. Okay, so I am taking the intraocular pressure measurement of the patient. Okay, this is applanation tonometry, Goldman applanation tonometry, and this is basically the gold standard of IOP measurement. Okay, so let's see some other videos. Okay, so now if you can appreciate here, this is a procedure going on. So the patient is seeing in front and I am covering the eye and then uncovering the eye. Okay, so can you see Dr. Shafiq, Dr. Shivam? I am covering the eye and then I am uncovering the eye. So this is basically called a cover uncover test. Can anyone tell me where we do a cover uncover test to detect what? So what I do is I basically tell the patient to fixate an object at an object. Okay, so let's say I have this object in front of me. Okay, I am telling the patient to fixate an object and then remove the cover. So any manifest squint. Okay, so what is Shafiq? Any manifest squint, if it is there, we can basically detect that with this test, which is called cover uncover test. Okay, so cover uncover test, very good Dr. Ritik. It can tell you about the any type of manifest squint here. Okay, so a similar procedure is where you can check both manifest as well as a phoria. Phoria is called latent squint. Meghna, phoria is called latent squint. Okay, so can you see here, I am covering one eye, then I am covering the other eye, covering one eye, then I am covering the other eye. This is called alternate cover test. So now can you get the difference, Dr. Ritik? Cover uncover test basically is we cover the right eye, then we cover the left eye. We cover the right eye and then we cover the left eye. This is cover uncover test. If I cover only one eye and then remove the cover, this is basically called cover uncover test. Okay, so we have two types of test, cover uncover test and the alternate cover test. Okay, let's see some more videos. Okay, so can you appreciate what is this procedure going on? So what is this procedure? What is this instrument which is in my hands? So I show it to you again. What is this instrument which is in my hand and what is the investigation I am going on? So this instrument which is in my hand is basically a direct ophthalmoscope. So Shafiq, it is not retinoscopy, it is the direct ophthalmoscopy. With my right eye, I am examining the right eye of the patient. What are the two things which we can basically detect with this? We would detect let's say any abnormality in the optic nerve, or we can also get any abnormality in the macula from this direct ophthalmoscopy. Okay, this is a direct ophthalmoscopy going on which can tell us about the status of optic nerve head and macula. Remember, direct ophthalmoscope cannot see the periphery of the retina. So for the periphery of the retina, we need another investigation. So let I show you another investigation. So can anyone tell me what is this investigation going on? So I have something on my head, mounted on my head, and with a lens I am putting the light inside. Okay, I am showing it again. Something which is there on my head, and with that, with a condensing lens, I am putting the light inside. So what is this investigation going on? So very good, Dr. Pranjal. This is an indirect ophthalmoscopy going on. When we do indirect ophthalmoscopy, whenever we have to see the peripheral retina. Very good, Dr. RB. When we have to see the peripheral retina, okay, there, let's say retinal detachment, lattices, okay, so there you can use a indirect ophthalmoscopy. Remember, for direct ophthalmoscopy, you have to see the optic nerve head and macula. Okay, so let's show you another procedure. Okay, what is this investigation going on? What is this instrument which I am using? So see it here. What is this instrument I am using here? So I am showing you it again. So this is basically, this whole instrument is called a slit lamp. Okay, so Prabhakar, indirect ophthalmoscopy is always done in a dilated pupil. So what this investigation is going on is a slit lamp examination. With the help of slit lamp, what we can do is we can see the anterior segment, that is your cornea, your anterior chamber. We can see the various stages of the lens, and then with the help of a 90D lens, 90 diopter lens or a 78 diopter lens, we can see the optic nerve head and macula also. So this instrument which we are using is slit lamp. Another use of slit lamp is that it helps to do a applanation tonometry, which I showed you, and another procedure which is called gonioscopy. So Dr. Shafiq, can anyone tell me where we use a gonioscope? In what, to know what we need a gonioscope? So here is an investigation which I am showing you. So can anyone tell me what is this investigation going on? With the help of a slit lamp, I am putting a instrument. Very good, Dr. Pranjal, it is angle closure glaucoma. So Dr. Pranjal, can you appreciate what is this investigation going on? You are seeing I am putting a instrument over the cornea here. So very good, Dr. Diksha, I am putting a instrument over the cornea here. So this is basically a gonioscope, a 4-mirror gonioscope I am using. So do not confuse this investigation with the applanation tonometry. Okay, so here you can see I am using the yellow light. Okay, and this is something which is basically held with my hand. Are you getting my point, Dr. Diksha? So this is a gonioscope. Okay, and this is not a applanation tonometry. So Shivani, whenever we use a cobalt blue filter, the thing is we have to see green Myers. So to see the green Myers, I have to need a blue light there. Okay, so that's why I use cobalt blue filter in a applanation tonometry. So I would show you again the procedure of tonometry. So if you can appreciate, Dr. Shivani, I am putting the fluorescein dye. So this would help me in getting the Myers. Okay, and after putting the fluorescein dye, I am using a cobalt blue filter. Can you appreciate here? So Diksha, this is a cobalt blue filter what I am using here. Okay, so let's move to the next video. So this session I have designed to have something different. Okay, so all the times MCQs, we are not getting the concept. We are just making not doctors, just the MCQ specialist. So I just wanted to basically put some practical situations in front of you. So what is this procedure going on? So my head is there, my head is placed on a chin rest, and then I am basically, whenever I am seeing a stimulus, I am pressing the button. If there is total corneal opacity, Shafiq, then the angles won't be visible. So very good, Dr. Shivam. This is a perimetry going on, a Humphrey visual field perimetry going on. So can anyone tell me where we use Humphrey visual field perimetry? In which disease we use Humphrey visual field perimetry? So basically this is a automated perimetry. Okay, whenever the patient sees the stimulus, can you appreciate one eye is closed? From the other eye, whenever he is seeing the stimulus, he is pressing the button. Okay, so this is a perimetry going on, and we do a perimetry in the cases to see any glaucoma. It is also used in the cases of visual pathway lesion. Let's say you have a bitemporal hemianopia, you have a homonymous hemianopia. So with the help of visual fields, we can also not only see the progression of glaucoma, we can also appreciate any visual field defect in a visual pathway lesion. Is it clear, Dr. Shivani? Okay, very good. So let's see some more videos. So can you appreciate what is this video going on? What is this procedure? I am neutralizing the reflex with the help of an instrument. I am telling the patient to see straight, and then I am telling the patient to neutralize, basically doing a neutralization of the reflex. So can you appreciate once again? Here I am putting light at a 1 meter, and with the help of lens, can you see here I am using some lenses here, and there I am neutralizing my reflex. So what is this procedure going on? So this is a retinoscopy going on. Very good, Dr. Shafiq, Dr. Meghna. It is a retinoscopy going on. We tell the patient to look straight, and then with the help of retinoscope, we see the orange reflex that is coming from the fundus, and with the help of lens, can you see my lens here? What I am doing is I am neutralizing the reflex. Okay, so this is retinoscopy. Do not confuse a retinoscopy with a direct ophthalmoscopy. So I am showing you a direct ophthalmoscopy once again. Can you appreciate this? So this is a direct ophthalmoscopy going on. Okay, so do not confuse a direct ophthalmoscopy. Direct ophthalmoscopy does not tell you about the refractive status of the eye. The retinoscopy tells you about the refractive status of the eye. Okay, one more hint here. If you can appreciate, when I showed you a video of retinoscopy, can you see here? There, if you can appreciate, there is a trial frame putting here. Okay, I am putting the lens in front of eye. So this is not a direct ophthalmoscopy, this is a retinoscopy. Okay, so the Shivam, the handle is same. The handle is same, the upper part is changed. Okay, so here I put a retinoscope, and there I put a direct ophthalmoscopy head. Okay, this is called handle. Okay, and this is called head. I have this right now here also. Let me see. So can you see here, everyone? Can you see this? This is the handle. Okay, I can put streak also. This is my streak. Okay, when I put it here, so then it becomes retinoscope. Can you see it, this? Everyone, can you see this? So this becomes the retinoscope. Okay, so let's see some more videos. So this is, can anyone tell me what is this procedure going on? So this procedure I do when I cannot see the retina. So I am putting a jelly. Ideally the patient should be basically in supine position. But right now to show it, I am showing it like this. I have put a jelly, then I am putting a probe over the retina, and then I am seeing this image. Can you see this image? So can anyone tell me what is this procedure going on in the eyeball? So basically what I am doing is, very good Dr. Shivam, I am using a B scan, ultrasound B scan here, okay? B means brightness. Can you see the bright white light here? So this is basically our eye coats, and inside this area is basically our vitreous. So let's say you have a hyper mature senile cataract, you have a vitreous hemorrhage, you have an endophthalmitis where you cannot see the status of the optic nerve head or retina. So in that cases we do a B scan, USG ultrasound B scan it is, okay Shafiq, it is not OCT. Okay, so let I show you few more videos. Okay, so I think I have shown everything. Now those students who have just joined now, I am just revising the all the 12 videos that I have showed. So put in the comment section what it is very fast. What is this surgery going on? What is this surgery going on? Try to answer. So very good. Which type of cataract surgery? Shivani, which type of cataract surgery it is? There are many types of cataract surgery. ECC, phaco, SICS. So which? Very good Dr. Shafiq. It is a phaco surgery going on. Okay. So let's move to the next video. So what is this procedure going on? So what is this procedure going on? Dr. Ranjit, Dr. Namrata, what is this procedure going on? I am putting it 4 millimeter from the limbus. So very good, it is the intravitreal injection. Okay, now let's move to the next video. So what is this procedure, this surgery going on? No, it is not a squint surgery, okay? It is intravitreal injection. So what is this surgery going on? I am making a scleral flap, and then I am making a incision, a hole in the sclera. Yes, what is this procedure? What is this procedure called? What is this surgery? So this surgery is trabeculectomy, not Shivani. It is not vitrectomy, it is trabeculectomy. Trabeculectomy is done in the cases of advanced glaucoma which is not managed by the medical therapy or your iridotomy. Okay, this is a trabeculectomy. You get my point, Dr. Shivani? Okay, so let's move to the next video. What is this procedure going on? I just told you, be very fast. So what is this procedure going on? So very good, it is the applanation tonometry, the IOP measurement going on. Okay, very good Dr. Shivani. Let's see the next video. So what is this procedure going on? And where we use this procedure? Where we use this procedure? Yes, Namrata, it was slit lamp with the tonometry going on. So I am showing you the procedure again. Yes, very good. It is the cover uncover test. So can you tell me, Shivam, where we use cover uncover test? In which condition? So very good. It is basically used to see